Three,
Oh.
maybe yet three.
Three, yeah, the pandemic, mixes everything up. So yeah, 3 years ago. So we were there, and we with Professor Guido Macchiarelli also, and Professor Stefania, and Sharif, right? He was there as well. Yeah, so it was very, very nice meeting we had there.
Okay, now is the time up.
It's time, we can start.
Yes. Dear participants, dear colleagues, dear friends, there are a lot of young scientists, students, and specialists. Welcome to our workshop. Today is a very good day because you have possibility to listen a famous specialist. It's Professor Diego Paes from Portugal and his colleagues, Dr. Nuno Domingues. It's an excellent possibility. Today is a listening, study, this some methods, and we will enjoy to listening and take some information about how we can use a cadaver and how we can use this knowledge in our medical practice in the future. Please, Professor.
Thank you very much. So, Nuno, please, you can share the screen. Okay, ladies and gentlemen, dear colleagues and friends, thank you, Professor Gulmira. I have to especially thank you, Professor Gulmira, for giving us this opportunity to share with you and with the participants our experience at the Nova Medical School of preparing the conditions to have cadavers of good quality for very exceptional surgical hands-on courses on the human cadavers. This is an experience that we have had for many years, and I'm very glad that we have this opportunity to share with you. I am the professor and chairman of the Department of Anatomy. I'm also the donation officer, so I'm in charge of the donation process. And without further delay, I pass the word to Dr. Nuno Domingues, who is going to present himself and also our workshop.
Hello, good afternoon to Almaty, and this is good morning for Portugal. My name is Nuno Domingues. I'm a urologist at the Lisbon Hospital in Portugal. I would like to thank the organizing committee for being here present, and also I'm going to send a big thank you and a big hug to Professor Diogo Paes for the invitation. I'm honored to be here to share our experience with the audience. Me and Professor Diogo Paes tried to make a presentation about our experience on hands-on courses on human cadavers. So we'll try to give you the best experience possible as you were physically present at our university. So without further delay, I will start. So thank you, Professor, for the kindly words. I tried to put the agenda for the work for today. So we'll speak about the surgical training. How is the surgical training for the surgeons in Portugal and also in Europe? After that, we'll do the big question, cadaver surgery, what you need to have. This is a small practical tips for the audience and for people who want to build cadaver course like we have it. So we'll try to pass our experience on it. After that, the body donation at the university, and then we'll speak a little about the embalming technique, which is very important technique to do the cadaver embalming, and the Professor Diogo Paes will give us his extraordinary experience in the embalming technique. After Professor Diogo Paes speaking, I will speak about my own experience on the human cadaveric advanced courses. We call it UCAT. So if you put on the internet UCAT, automatically will appear our pages on the internet, on the Twitter page about our UCAT courses. So I invite you to go to the internet after the end of the session, and you could share the experience with you in the website. After that, Professor Diogo Paes will do their final remarks, and please, we are free to answer at the end of our presentations questions from the audience. So I invite you to put the questions you want on the chat room during our presentation, and at the end of the works, we'll try to do our best to answer to you all, okay? So what is the surgical training? How the surgeons do their training? Normally, the surgical residence, it's the after medical graduation. Here in Portugal, the surgical specialties have a curricula of 4 to 6 years of surgical training. And then after the residency, how the surgeons are able to maintain their skills. See one, do one, teach one. This is a true phrase. And then what about new surgical techniques? How will we do it? Are we going to do it on real patients? How we do it? How we train? We have something to train. We have the postgraduate training. We have the simulators. We have the endotrainers that we are going to see during this presentation. We have workshops like this when you can learn a lot. We have live surgery when you can see surgeries from the experts. We have surgery videos. So if you go to on the internet and you put the surgery you want to see, you have a lot of videos that you can learn. And in the laparoscopic surgery, we learn a lot seeing videos from other colleagues, okay? And we also have the fellowships where you have a small audience that we can share our learning in the operating room. And we have, of course, the animal surgery. But nothing seems to replace surgery on the real patient. Will it be legal or moral to train in live patients? I'm not sure about this. So what's best? Surgery on cadaver. We have the perfect model for surgical training. The cadaver surgery, it's like real live patients. We will see that during the course. So cadaver surgery, what we need to have? We must have 3 things. The first one, it's body donation. Without cadavers, it's impossible to have cadaver surgery, of course. And in another medical school, our university will have that. And Professor Diogo Paes later will do that presentation about the body donation program in the Nova Medical School. And the second thing, the embalming technique. Without the embalming technique, the cadaver will be useful because it was impossible to have the courses without an embalming technique that could be used among all the students. So Professor Diogo Paes will speak about that experience and the innovation technique that we bring to the scientific community. And the third one, the place to do it. If you don't have a university or a medical school that you could help you to organize this cadaver surgery, it will be impossible. So I'm a lucky guy because I have these 3 things among our university. So my talk will be about human cadaver advanced courses, the UCAT, in the Nova Medical School. So without further delay, I will pass the word for Professor Diogo Paes to speak about the body donation. So, Professor, the audience is yours.
Okay, so yesterday in our body donation around the world roundtable, I did very briefly talk about this, which I am going to develop today a little bit, because as Dr. Nuno Domingues said, without cadavers, there is nothing we can do. So there is no training possible, either pre-graduate or post-graduate course. One of the things that is extremely important to have donors and to have registered donors is to have a legal framework for the use of cadavers for teaching and research. So before 1999, we just had an ordinance from 1913. Then in 1993, we have the transplantation law in Portugal, which will be useful, as you will see, for the decree law of 1999 that regulates the use of cadavers for teaching and research. So the ordinance that we had before just told us that medical schools were allowed to obtain bodies from people dying in hospitals, asylums, or public assistance houses, provided they were not claimed in a 24-hour period. And we still have this today. This still happens today in the law. Now, in 1993, the transplantation law is very important. You understand that in Portugal, this is an opt-out policy, which means that every individual resident in Portugal, either Portuguese or foreigner, resident in Portugal, is a donor, a potential donor. So, which means that if you die, they can collect organs for transplantation. Okay, so what happens is, if you don't want that your body is used for this purpose, then you have to go to the Ministry of Health and register your name on the non-donors national record, RENDA. This is the way you are telling the society, I don't want that my body is used for transplantation. What happened in 1999 with the publication of the decree law that regulates the use of cadavers for teaching as research is that the Parliament harmonizes the two laws, so the transplantation law and this one, by using the non-donors national record also for the purpose of teaching and research. So if you don't want in Portugal, if you don't want your body to be used for teaching and research, then you can go to the Ministry of Health, register your name in non-donors national record, the RENDA, which makes that our department, when we get a body, even if the person came in life to donate the body, we have a compulsory consultation of the non-donors national record to see if by any chance the person is registered there. If it is registered, we cannot use the body, okay? So, departments of anatomy are required to pay all necessary costs, including transportation. Also, for this purpose of teaching and research, we need that the donor comes to the medical school and tells you, I want to donate my body to this particular medical school, okay? It's where I want my body to be used for the advancement of science and for preparing better doctors. Good records must be kept about all the process, and commercial exploitation is strictly forbidden. Also, immediately after the publication of the law, the Portuguese Anatomical Society undertook a huge campaign producing a leaflet called Donating is Human. And this leaflet was distributed in every hospital and clinics and everywhere where patients were being treated. And this was extremely important in Portugal because everybody had access to this information. Why is it so important for society that you donate your body to medical schools? Okay, so the donation office, as you can see in this slide, is providing support for pre-graduation teaching, post-graduation, and research. So the pre-graduation for several subjects, several courses: anatomy, regional anatomy, fundamentals of neuroscience, radiological and clinical anatomy, and biomedical engineering studies. For post-graduation, for all the courses like the one we are going to talk to you about today, and for Master of Science and PhD programs, and also for research that is not related to obtaining degrees. Now, the numbers. You can see that before the law and before the campaign of the Portuguese Anatomical Society, we had 79 donations from 1982 to 2000. And then from 2001 to 2020, we have 3,564, which means, and 73% are female, 27% are male of our registered donors. So you see that in the first period of 19 years, we have an average of 4 donations a year. But then the campaign of the Portuguese Anatomical Society and the decree law publication had made this boom in the donation process. So you have in 20 years an average of 178.2 donors registered donors a year. You see that in 2019 we had a record of 348, and you can see what COVID did to this process. So in 2020 we just had 115, which means a 67% reduction in body donation. Donation office has naturally several aspects that need to be analyzed. So the facilities, the procedure and documentation, the compulsory render consultation, so the non-donors national record consultation, embalming and conservation, and the records, some limitations in transporting the bodies to our department, and the management of cadavers. So donation office, as all offices, has a door, right? And then this is where we receive our potential donors. And here you can see that we have a secretary, Dona Teresa Souza, and you have a donor which has to be kept anonymous. Of course, this person here is anonymous. You don't know who it is, right? Okay, so this is a letter that we send to people that ask about the body donation program by mail. And this is the declaration that they write for the registering their donation, their bequeathal. Now, this is a letter that will accompany the person after the donation process. They have the contacts and telephone numbers when the person dies. Every donor will bring a card, and this card is, they are very proud to bring this card all the time with them. This is the form for the consultation of the non-donors national record. This is the form that we use for each cadaver, which identifies the tag that the cadaver has on the earlobe, identifies the donation process, the consultation of the non-donors national record, how the embalming process was done, and if anything happened during embalming, and where the cadaver was used and when. This is compulsory by law. This is the perfusion machine, one of the prototypes that we use for perfusing the embalming liquid. We are going to talk about that later. So these are the conservation units. We have two types. We have freezing at -20 degrees centigrade and the conservation at +4 degrees centigrade. So this is what identifies each of the cadavers. This tag that is in the earlobe of the cadaver, the sex, the number of donation process, and the date in which actually we just state the month and the year now, the month and the year when the body arrived to our department. This way, it is impossible to identify for someone that comes in the dissecting room, no way they can identify the person. We have to keep them always anonymous. The technician in the dissection room also has a form to write all the courses where a cadaver has been used. This is the form that, or the letter that accompanies the cadaver when it goes to cremation process after the use it has served society by dissection, by post-graduation courses, by research. Then it is cremated. And the ashes, of course, can be given to the family members. The family members actually can go to the cremation site. Now, there are limitations for receiving the bodies. Distance is one of them because the medical school is paying for everything. And so if it exceeds a certain amount of kilometers, more than 200 kilometers, more or less, or 300 kilometers, we may not be able to bring the body to our medical school. Sometimes the family members say that they want to pay for the transportation, and this is very good. Also, they are excluding diseases. For instance, COVID, of course, we did not receive COVID patients. Patients with sepsis, that died with sepsis. Well, those diseases that impose a risk, a public health risk for the people that are going to use the cadavers. Cadavers must be managed, and this is extremely important. Because if, for instance, you want to do a gynecology, a post-graduation course, okay, this has to be a female, right? And then you have to look at the clinical records to see if that person had been hysterectomized, so has no uterus, and and this way you cannot choose this cadaver if you are planning to perform an hysterectomy during the course. Also, maximizing the use of cadavers. So we have the medical students performing dissection of the limbs or dorsum or head and neck. We can use this cadaver for laparoscopic abdominal surgery as well. Okay, so it's maximizing the use of the cadavers. Most importantly, in our medical school and in our department and in the dissection room, everybody hears this word all the time: respect. This is what we can give to our donors after they have provided us with something that is the most precious thing they have, which is their body. Of course, this symbol is important and it represents respect. Okay, there could be other symbols of other religions, like you have in chapels in airports, prayer rooms in airports. I don't mind that you have it, but the population in Portugal is mostly Christian. We have this symbol here for respect. This is the most important thing. Okay, now we are going to talk about the embalming process. So the first thing is to have a good donation program. Then you have the cadavers, and you need to have a very good first quality embalming technique. Otherwise, no one is going to want or choose our school to do post-graduation surgical courses. So you see, we have published this paper about the improvement of embalming perfusion method, where we explain this, the method of embalming, and also the research project that we have done, we have performed, collecting tissue samples from the cadavers before they are embalmed, and then after embalming, 1 month, 2 months, 3 months, 4 months, and so on. And studying it in histopathology, and it's outstanding, the quality of the tissues after many months, as you will see in some pictures that I'm showing you. Also in 2015, Balta and collaborators wrote this paper, The Human Preservation Techniques in Anatomy, in the journal Clinical Anatomy from the Egyptian until modern times, and stated that the importance of the contribution of our school for the embalming of cadavers. And here you can see examples of muscles after 1 year of embalming. Okay, this is a plastic surgery course. So you see the quality, it's almost fresh. It looks fresh, it's outstanding. Here you see the knee with the cruciate ligaments, okay? And here in a urological laparoscopic course where you can see the kidney, and this you can we are going to show you much more about this afterwards. So now I'm going to show you the video that shows how embalming process is done in my department. I hope you can see. So
yes,
I'm
seeing,
showing,
Professor. We are seeing.
Okay, good. So I'm showing here what are the arteries that can be used or we use for embalming the cadavers. So the carotid artery or the axillary arteries. The axillary artery we actually use only if we want to embalm just the upper limb. You'll see that we prefer use the femoral artery. The femoral artery is the one that we are going to use in this video, and that's the one we use most of the time. So the femoral artery with naturally the femoral vein medially located. So now I'm going to show you the embalming process. But before, let me point out the bony landmarks, which are very important. So the superior anterior iliac spine and the pubic tubercle, okay, with the inguinal ligament. And actually, what we will be looking for the middle third of this space, and this is where we will eventually find the femoral artery. So we have many instrumentation, the surgical instrumentation for the procedure. I ask that you please turn off the phone, please. Mujibu. Thank you. Okay, we have the catheters of different diameters, and now I'm going to check the bony landmarks. And so the anterior superior iliac spine, the pubic tubercle, the inguinal ligament, and the middle third. It's in the middle third that on the thigh, I'm going to find the femoral artery, okay? And now we start embalming. So we do the incision. All of this, as you will see, is done very, very carefully. Okay, I use my favorite scissors, the Metzenbaum scissors, for dissection. And we are doing this very carefully because sometimes the Saphena magna vein is very superficial, as you will see in this case. So we proceed very, very slowly. And you start seeing there there's a vessel here that I saw superficially. Okay, see there? Okay, this is the saphena magna. Okay, and I have seen inexperienced staff members doing the embalming in this vessel, thinking that they found the femoral artery. That's a huge mistake, obviously. So must be extremely careful not to cut, to sever the vein or any large vessel, because this will be very bad for the embalming process. We need pressure inside the system, the vascular system, so we cannot cut big vessels. Okay, very carefully. And because this vein is located superficially and in front of the femoral artery, you see we are in the middle third here. So it's right in front of the femoral artery. I'm going to ligate the vein proximally and then distally, and I'm going to cut the vein. And now we can cut the vein safely so that the embalming liquid is not going to come out of this vein. Okay? Little blood residue, of course. Fine. And now we can proceed in deeper. We are starting to see here the pectineus muscle. So we go medially to the pectineus muscle. See the third, this is the third, okay, the middle third. And I'm expecting to find the artery right here. So you are not going blind, of course, you know the anatomy and so you're going directly to what you want to find. And so I'm now in the subfascial plane, and there it is. The femoral artery is right there. Okay, you see? Now we're going to have to carefully identify the other elements of the anatomical landmarks. So we have to locate the vein, the femoral vein, usually located medially or slightly posteriorly to the artery, and also the femoral nerve, laterally to the artery. So we have to make sure that we are in the right place. And very, very careful not to touch the femoral vein. That would be total disaster. So the femoral vein is here, right? You have seen it right there. So you see the vasa vasorum on the surface of the femoral artery. This helps identify the artery. And so being sure that it's the femoral artery. And now we locate on the laterally to the artery is the nerve right there. So the nerve, the artery, and the vein. Nerve, artery, and vein. And so now we are going to individualize the artery so that we can insert proximally and distally the catheters where we will perfuse the embalming liquid. Extremely careful. Okay, there you go. Okay, now we're going to place the silk sutures that will fix the catheters. So proximally and distally. Okay, now we'll do a transverse incision, being very careful not to cut the whole artery, otherwise with the elasticity of the walls of the vessel, the artery would disappear. So we have to be very careful. It's just a small incision, okay? You see that there are atherosclerotic plaques here. This can be a problem. We will see that later. So plaques of atheroma. See, we are now trying to, you see, the scissors cannot go further because there are a huge accumulation of atherosclerotic plaques. So we will force a little bit, and there we go. Okay, this way the catheter will go in. We choose a catheter with a good diameter for the artery. It's going to go in very easily, as you can see. It's important that it goes quite a while, quite a long way, because the pressure for perfusion is very high, and so we need, or quite high. So we need that the catheters are very well fixed. So this is what we are doing. First, around the artery, and then you will see that we reinforce this by fixing the catheter. You see, this is a safety measure, so that this way I'm absolutely sure that the catheter is not going to come out during the perfusion. So the proximal catheter is inserted and fixed. And now the distal, the one that is going to the right lower limb. Okay, there it goes enough, right? And now we are going to fix it as we did in the proximal catheter. Okay. Now we fix the catheter. Very well. And there you go. There's no way these catheters are going to come out. And now we are going to connect the catheters to the perfusion pump machine. Okay, this is our technician. So the embalming fluid that we use is an aliphatic alcohol. And we add some pigmentation. Actually, we have chosen from different brands and different types of pigment that mixes well with the embalming fluid. And it's a red pigment. Okay, and now we are ready to start. Importance here is that this is the recipient for the liquid, the embalming liquid. And something that you will see is that we use a pulsating perfusion to mimetize the heart pump, so the pumping of the heart, okay? So you see a pulsating. This is very important because it will really make the liquid go to every single part of the body. The liquid with the pigmentation on the proximal catheter here and on the distal catheter as well. Now we can increase a little bit the frequency to 60 pulsations per 70 pulsations per minute. And we start seeing the superficial veins ingurgitating. You see the ingurgitation of the superficial veins. You also see the accentuation of the hypostasis. And most importantly, to control your embalming process, we are going to look for something that I'm going to show you right now. Here, you start seeing this orange peel. We call it an orange peel aspect, which means that the embalming fluid has reached the dermis, okay? And this is the indication for us that all the tissues on the body have embalming fluid, okay? This is very important, and we do about 5-6 liters the first day, and 24 hours later, we do another 2 liters, 1-2 liters to reinforce the embalming process. And then the cadaver is transported to the freezer or to the conservation unit to be used. We normally don't use it immediately, but so it usually goes to the freezer, the freezing unit at -20 degrees centigrade. So there you go. We do a continuous suture so that aesthetically it looks nice. You see the artery exactly in the middle third of the inguinal ligament as was expected. Okay, and this is the end of my video showing you the embalming process. And I give the word to Dr. Nuno Domingues to continue.
Thank you, Professor.
Thank you.
Thank you, Professor, for your wonderful presentation. You can share to the world your experience and the body donation program and also the embalming technique. In my humble opinion and my colleagues, urologists around the world, for us, it's the best embalming technique worldwide known. And I will try to do my best to show you why. So without further delay, we continue our workshop. So I will speak about the third part of the cadaver surgery. So after we have the cadaver and the embalming technique, as Professor Diogo Paes told us, we have the perfect conditions for do the course. So what better place to do it in university and medical schools. So we built the Human Cadaveric Advanced Course, the UCAT, in the Nova Medical School. I must say at first that our course has the approval of the Ethical Committee and also the Scientific and Pedagogical Committee of the university. This is very important. If you want your course to be a good course, you should have all the approvals before starting. And the ethics approval, it's mostly important. Without ethic, we are not able to do a good job, as Professor Diogo Paes told us. It's very important to respect the cadaver. It's very important to respect the people that gave us the best they have, even in death. It's their body. So we the surgeons should respect this daddy from our patients. So I'm going to give you my perspective of the Human Cadaveric Advanced Course. This is the imaging of the first edition that took place in 2018. I have an invitation in 2016 by Professor Gori O'Neill and by Professor Diogo Paes to build a laparoscopic urological course. So I tried to manage to build a high-level course from the beginning. Why? Because if you want to do something big, you should think the better. The better you think and the better global you can get, the better you can do your course. This is the imaging from the second edition for 2018, and this is the last year edition in 2020. We tried to do our best, improving during the courses. So as you can see, in last year, we have the laparoscopic urological course with 3D imaging. It was outstanding imaging course with the 3D imaging that help us surgeons to see better our patients. This is my perspective of the UCAT courses. We have a Twitter page that I invite you to share and to see. It's the Urology UCAT. You put on the internet and you have all the information you can get. As you see here, among our course, we have all scientific supports that we can have from the national and international authorities. It's very important that you have a credible course among the scientific community. So we do that from just the beginning. And also it's very important to have sponsors from the industry, because without that sponsor, without the economic sustainability, it's very difficult to have the courses. So cadaver surgery, what you need to have. First, always think high, do higher, be the highest. If you want to build a high-level course, you must put your standards very high to be able to build something big like this course, I think. Also do it in university and medical school. Don't forget to get the ethic approval and the scientific and pedagogical approval from your university. Don't do this course outside university and outside medical schools. Don't do it, because you will not be credible among the scientific community. And the only place when you can do it in a good way and in the correct way, it's in your university. Choose an official language to be global wide. Don't do a course like this in your native language. In Portugal, we pick the English as the international language, and we do not do the course in Portuguese, because if we do the course in Portugal, only Portuguese people come to the course, and we will try to get our best to have people from all around the world, as you can see it. Don't forget to get help from national and international board experts. It's very important to involve all your colleagues from all your country and also for your friends among your friend countries like Europe. In our course, in our UCAT courses, we have national and international faculty. We have a lot of friends among Portugal and especially Europe. Don't forget to get the scientific supports and the industry supports. This is very important, as I said previously. Choose quality instead of quantity. It's better to have small courses with quality instead of a lot of courses without quality. Don't forget, first quality. Don't forget this big idea. And always evaluate the students and also the faculty. During our course, we have a very strict program of evaluate the students and also the faculty. That gives us the opportunity to improve in all the editions we have. Economic sustainability. Without funding, it's impossible to build a course like this. If in your analysis you don't have economic sustainability, don't do the course, because it was going to be impossible to have it without funding. And after that, you have all of this. Please have fun and enjoy. I can give my own experience. During this week, I'm doing the cadaver surgery. I have a lot of fun and I have a lot of enjoy. Why? Because I have the opportunity to be with my friends all over the country and all over the Europe, and have colleagues that came from all over the world. And it's very nice to have the experience from different people in all around the world. That's why I'm very honored to be here today to share to you, to the audience, our experience, because being a doctor and the medic, it's like this. It's give experience to the other people. That's this thing we made when we become doctors. We have the compromise to teach other what we know. That's the way that medicine goes along the decades and all the years. So I'm very honored to give you my experience. So I'm going to give you the course introduction as you were all students of our course. This is the slide I used during the presentation of the courses. Here you have an imaging of the operating theater in the Nova Medical Schools. During this day, we have a 3 days course completely hands-on. During these 3 days, we have 24 hours of surgery. It's like a big surgical marathon. Normally, I tell to the students during the presentation, during these 3 days, in the end of the first day, you will be tired. In the second day, you'll be exhausted. And then at the end of the third day, we'll be dead and we'll be a cadaver for the next year edition of this course. Of course, this is a small joke. I do it because the non-student ends like that, okay? But they ending very tired and very exhausted, but they are very grateful and they enjoy a lot of the course. This is unique worldwide. Why? Because we have cadavers, we have the embalming technique. In my opinion, it's the best worldwide. I will show you why. And because we have a student-tutor ratio of 1:1. This is very important. Have your tutor right beside you, giving his teaching and giving his tips and tricks during your surgical sessions. In our courses, we have a maximum of 18 students and 25 experts from 4 different continents and from 14 different, for 4 different continents and from 14 different countries, okay? In the last edition, we have colleagues that came from Brazil, Costa Rica, United States of America, Saudi Arabia, Iraq, Italy, United Kingdom, Greece, Spain, Switzerland, France, Slovenia, Moldavia, and Portugal. And I hope next year edition, I have someone from Kazakhstan, okay? Please, feel free to come if you want. Normally I say this, part of the world will be present at this event, united for just one purpose, learning to become better surgeon. This is the maximum of our course. We are here for one thing, be better surgeon for our patients. This is the best thing that you can get from this course. It's to be a better surgeon. For you being a better surgeon, you will treat your patients better than before coming to this course. So let's the game begin. This is the operating theater. Normally, I divide the operating theater in 6 tables. I put 3 students per table. One student has a surgeon, the second has an assistant, and the third one has the camera. And all 3 rotate during the day. This is the picture of the operating theater. As you see here, there are 6 operating rooms. And I have also this big screen when we put some information and the videos about the surgery. So before they go into the operating room, they see the surgery and they see the experts teaching how to do it. This is the flyer that we gave to the students before starting the course. So the course description is the Human Cadaveric Advanced Laparoscopic Urology course is a new innovative course for surgical training. This 3-day course should provide a surgical experience that is close as possible to reality. The program will cover a wide range of technicals of urological laparoscopy. During the course, each participant will have an opportunity to have hands-on experience in various laparoscopic techniques, and their practice will be made under 25 expert supervision. The course is limited to 18 participants without previous laparoscopic skills, divided by 6 stations, 3 per station. All station we have 3D laparoscopic imaging. The course objective, the main aim of this course is the improvement of the participants' skills in laparoscopic surgery through training models very similar to live surgery. And what about the assessment methods? During this course, we have the evaluation. We divide the evaluation on 3 things: continuous assessment, surgical skills. At the end of the day, every tutor give me the grade of the surgical capacity of each student. So we have the scale to give the students a note, a grade, to give me the impression of the surgical skills. The second part of the evaluation, it's a written work about laparoscopic in urology. They write a paper at the beginning of the course about laparoscopic urology. And the third part, it's a written test. The written test is about the bibliography and the papers we gave to the students 1 month before the course. So every student 1 month before starting the course will receive on their email all the information they need to study. And they will receive also videos to see the videos, the surgery that they are going to do. This is very important. Before you go to the operating room, you should observe and see the videos, okay, to help you to perform the surgeries. So this is our program. In the day 1, we have the introduction part, the opening ceremony, when we invited all our colleagues from Portugal and among Europe. Normally, the president of Portuguese Association of Urology and the representative of the European Association of Urology and from our Nova Medical School are present in our opening ceremony. After that, we have a small talk about the body donation program and the embalming technique, very similar that the talk we have just a moment ago with Professor Diogo Paes. And after that, we start our work. With what? Tips and tricks in laparoscopic surgery. Have a small talk about some tricks in laparoscopic surgery. Do it by a very friend of us, a colleague that came from the United Kingdom, from Leeds University. After that, we go to the operating room and we have the warm-up session. What is the warm-up session? The warm-up session, it's in the endo trainings that people start to get their know with the equipment in the operating room. This is our endo trainings. People who want to start laparoscopic surgery, it's not, you don't need to buy this thing. You can do it at your home. You have a box, a small shoes box, for instance. You pick up your webcam, you put it in that box, and you pick some instruments, disposable instruments in the operating room. You bring them to your home if you want, and you can do laparoscopic surgery. You can start like this, your basic skills, trying to do it by your own before going to the operating room. So this is the first part. So you can see at the end of the first day, they do the warm-up. So after that, we go straight to our program. We have a program that is divided in 3 parts. The first part will be the kidney part. So normally we start for theoretical session and video demonstration. Before going to the operating room, our experts give their experience to the audience and their tips and tricks about the surgeries they are going to perform. And after that, they go to the operating room to do the surgeries, as you see in this picture. And at the end of the day, we do the surgery, debriefing, and evaluation. This is very important session. Why? Because in this table, with all people around the table, the students and the tutors, we speak about the day, about their difficulties and what they want to ask us for improving their capabilities. And this is also the forum we use for the evaluation of the students and also from the faculty. After this first day, they go all tired home, but they all go all happy home. So I will gonna give you a video about the works, how we do it in the operating room. So I'll try to put a small video about this. So let's see a small video about this first day. This is the operating room. You can see the works going well. All 3 students are, this is me trying to get teaching from the students. He's the laparoscopic students doing the laparoscopic surgery. Please see this wonderful imaging. It's like real patients. This is kidney surgery. You see that the kidney island here. Very nice pictures from the kidney island. They are very interested. Here we are ligating the island, okay, of the kidney. So this is just a small video to demonstrate to you the quality of the human cadaver. So after that, we continue to the second day. Sorry, I'm just having this small trouble. Okay. To continue. Okay. This is the second part of our program, the day 2. We continue with kidney surgery. In the first day, we do benign situations. In the second day, we do oncological surgery. So, like I said, we continue with the same scheme. First, theoretical session and video demonstration with the experts. Then the students go straight away to the operating room when we perform oncological surgery. In the second day, we will perform adrenalectomy, partial nephrectomy, and radical nephrectomy. Then we have the lunch break, of course, because it's very important to have small periods of pause during this very exhaustive marathon. In the afternoon, we continue on the surgery, and has the structure of the first day. We end in with the surgery debriefing and evaluation. And after that, we have a special moment because it's our course dinner. This is a very important moment. Why? Because during a round table in a very beautiful Lisbon restaurant, we speak all about our experience and try to meet, to get us better in this wonderful space where you can see the castle, the Lisbon castle here, and we prolong the dinner during the night, and we can have this wonderful view of Lisbon and all the encants of our Lisbon city. And after the dinner, it's very difficult to get people go home because they want to be with us sharing this experience. But normally I said, now you should stop and go straight away home because tomorrow it's another day and it's the last day of our course and you should be fresh to continue the course. So we continue to the third day of the course, the last day of the course. It's prostate day. Prostate for us urologists is the surgery that everyone wants to do it. And it's very difficult to get training on prostate. Why? Because normally people go to courses with animal surgery, but animals don't have prostate. Normally the dogs have a small prostate and the pigs also have a very small prostate. So it's very difficult for the surgeons to get training from animal surgery in this kind of surgery. In kidney, you can have training in animals, but in prostate, it's very difficult. That's why people want to come to our course, because the human cadaver is the best model you can have for real surgery. So we continue with the same scheme. First, theoretical session and video demonstration. After that, we go straight away to the lab, do the surgery during the morning and during the afternoon. Normally, we pick up the lunch break to do a small guided visit to the university. Why? Because as you're going to see, our university is very beautiful, and I will like to show to our students the place where they are doing their course. It have a lot of history that they should know, the historic place where they are. And after that, we have the surgery debriefing and evaluation. At the end, we have the written test evaluation. We have a multiple choice test to do the evaluation about the papers, the bibliography that we gave to the patient, to the students 1 month before the course. So at the end of this third day, they all go very tired, exhausted, but they are very grateful to us because we give them teaching to become better surgeons in their own countries. This is very grateful for us, the experts, giving our experience to the others. I'm going to show you also the video about the prostate day and about the quality of the human cadaver. So just a little moment, because I'm putting the video. Okay, I'm going to put right away. I think you see the video, Professor. They are seeing the video.
No, you have to come out. You have to come out and
sorry.
then go in again.
Okay, yes. Okay, sorry.
We did rehearse this yesterday evening, and
yes,
it's the best way.
Okay. Now you see, Professor?
Yes.
Okay. This is a European colleague, Dr. Renaud Bolland. It's a gifted surgeon. I call him the Cristiano Ronaldo from Laparoscopic. We are very honored to have him among us, and his is the prostate day. We continue with the same scheme. Each tutor goes to teach the students in laparoscopic surgery. We continue with the same scheme, 3 students per station. They are very strict, addicted to the cadaver surgery. See here, the pelvic anatomy. This is like real patients. It's outstanding surgery, okay? And to finalize the videos, I'm going to give you a final video about laparoscopic surgery. Okay, just a small moment, please. Okay, so I'm going to share now. They are seeing, Professor?
Yes.
Okay, so this is the video about our course that we present at the Portuguese Association of Urology. And I'm very honored to say to you that this video won the first prize of the best video present last year in the Portuguese Association of Urology. And I'm going to give you also a breaking news. This video, it's going to be presented at the Worldwide Congress of Endoscopic Surgery. Why? Because the scientific community, it's gonna give us credit because they recognize that this cadaver, this embalming technique in this course should be worldwide divulgated among all of the urologists all over the world. So without further delay, I'm gonna give you this video. This video demonstrates the quality of the cadaver surgery, the quality of this course. This is a small picture about the perfusion technique, embalming technique that Professor Diogo Paes told us just before. And this is upper urinary tract surgery. As you can see here, we are introducing the trocar in the cadaver. This is like real patients. You see the like small bleeding inside the cadaver. This is the dissection to get to the kidney part. We use the same instruments that you use during the seizure, during the real surgery. You can see that we use scissors and bipolar, all the same instruments we use in real surgery. This is the kidney island. We are going to do a pyeloplasty. This is the ureter. We are cutting the ureter to perform a pyeloplasty. This is the small part of the ureter. Then the students start to do the anastomosis. Please see this outstanding. It's like real surgery. For us, this training is very important because doing the stitch in the surgery, it's the difficult part for us, doing the stitches. This is the oncological day. We mimetize here on the kidney a small tumor, so the students are going to perform a partial nephrectomy. They are cutting the renal parenchyma as they do in real surgery. And after that, they suture the kidney. This is the last day of our course, the pelvic lymph node dissection. Sorry, this is the retroperitoneal lymph node dissection. As you can see here, we are performing a lymph node dissection, a retroperitoneal lymph node dissection. Here are the lymph nodes of the retroperitoneal space. As you can see here. Here's the psoas muscle. And they are doing the lymph node dissection. We use the scissor with monopolar as we used in the real surgery. This is the psoas muscle, the lymph node dissection. We are just ending. Beautiful dissection, as you can see. This is the vessels. And this is the supraadrenalectomy surgery. This is left side patient. Here you see the spleen. And you are going to see the kidney here. This is the kidney. And you're going to see the supraadrenal gland. Beautiful dissection here. You can see it. Going to appear the supraadrenal gland. They are ligating the supravena, the supraadrenal vein, sorry, and this is the adrenal that we came out. The cadaver surgery in this part is much more difficult than in real patients. Why? Because this is a normal supraadrenal, and normally we take the supraadrenal that it's much more bigger. This is imaging of the last day of the course. This is the pelvic anatomy, as you can see here. They are going to do a pelvic lymph node dissection. This is the artery, iliac artery here, iliac vein here, and this is the lymph node dissection. See it, a very beautiful dissection. The vein here, this is the obturator part. So we say that with this embalming technique, we could perform all kinds of surgeries among cadaver. And I think this video demonstrates the quality of these surgeries. So I'm going to continue to the end of my presentation. Just a small moment, just me to put again the screen. Okay. So what is the impact of the UCAT in scientific community? During these 3 years, we are giving back the credibility from our colleagues from Portugal, as you can see in this paper. This is our official journal, the Portuguese Association Journal of Urology, that every year do a small report about what course. We are invited to go to the national TV in Portugal. Me and Professor Diogo Paes were invited to go to speak about this course. And also in the Europe world, in the European community, they gave us a small part in their journal to do a small report about our edition. So this is a picture from the European Association of Urology journal about this course. In the last year, we have an input from a student that do a small article to the European journal, giving us a lot of thanks because she loved our course. And this is the prize that we won last year with the best video presented in the Portuguese Association of Urology. So with all of that, we built a site in the Twitter area that called Urology UCAT. I invited you to come to see this site because it's very beautiful. I will try to give you my impression about the Twitter. I will share to you just a small moment, please. Okay, as you can see here, in this Twitter, you put UCAT courses and you can see all the news along the course. You can see our presentation because we announced in the Twitter that we are going to be here live at this wonderful Congress. And you can see also all the news about our courses. We have also the picture, the course picture. See, everyone is smiling in this picture. It's everyone wonderful for being at our courses. This is a small presentation about the student, about university history, that it's very beautiful. Here you see pictures about an outstanding room. It's like Capella Sistina in the Vatican. Professor Diogo Paes knows this room very well. because he works there. This is a very nice picture where we can see all the history of the Portuguese history, and also the medical history throughout the decades. It's a very beautiful space that I invite you to see if you come to Portugal and Lisbon Nova Medical School University. So I invite you to follow us on Twitter, UCAT courses. You can pick all the information. We have also small videos, as you can see here, about the course. So I invite you to share. So I'm going to end my presentation. Just a small moment. We are just finishing. Okay, this is our pictures from the students, as I showed you before. So for finishing, I would like to thank the organizing committee, and especially to the Nova Medical School and Professor Diogo Paes and Professor Gori O'Neill. They are doing a wonderful job, and I'm grateful for this kindly invitation, because the surgeons need this kind of courses to become better surgeons for our patients. So very thanks to the organizing committee, and thank you, Professor Diogo Paes, for this kindly invitation for this wonderful talk about our course. So Professor Diogo Paes, thank you a lot for your kindly invitation.
Well, just closing this session, I would like to thank Nuno Domingos for his presentation, and we try to bring you a little bit of our facilities, so of our medical school, and this is an example that I chose from many other courses that we have. This is one of the most distinguished, one of the most distinguished courses that we have, but we have many other different courses. I can also inform you that we are moving for other facilities close to the sea, near Lisbon, and this will be much bigger. We'll have much more stations available, and we will have a surgical training center, all equipped, and this is going to be very, so it's a step up. We are stepping up from this experience, but it has been very enriching, very grateful. We are very grateful for all of this. And the idea is really that you understand that when we try to build such the possibility for offering surgeons in training, and we have to start from the very beginning. So we have to do a very good body donation program. We have to deal with it ethically, and this is very extremely important. The respect that we have with our donors, it's really moving, you know, to see the willingness of our donors to bequeath their bodies for the advancement of science and for producing better doctors for the future, and also having perfecting an embalming technique and preservation technique of the cadavers, so that we can have this kind of courses where we bring the most distinguished staff from all over the world to come there, and also the participants, as you can see, that come from many countries around the world. So we now would like just to try to answer a few questions that came up in the chat.
Can I start, Professor?
Yes, sure.
Okay, thank you for your kindly words, Professor. I'm totally agreed with you. He have the best conditions to give the best courses that we can get to our colleagues and friends around the world. I invite you to go to the chat room if you want to do some questions. We try to do our best to answer to them all. I'm going to start for these two questions I have just in the beginning of a workshop. Question number one, which are the possible complicated related to laparoscopic? Sometimes this is a long and complicated process, and sometimes it takes long hours. So in the laparoscopic surgery, we have complications like we have in all kind of surgeries. But in laparoscopic, you should be very careful with the surgery. Normally, the laparoscopic surgery, the main complications, it's the injuries that you made during your surgery. The injuries could be vascular injuries that could be catastrophic, and the injuries also could be to the organs that are in the body cavity. Why? Because in laparoscopic, we should have very attention to the angles that you can see. Like in this presentation, you see my hands, but if I put my hands like this, you don't see it. So in the laparoscopic surgery, it's the same. Normally, you see this operating field, but outside the operating field, you don't see. So you must be very careful to do not damage the structures that you are not able to see, okay? This is a very important message. So I will say that we have complications, minor complication and major complication. That's why the training is very important. And to training, you just need to start with the endo training, a home endo training with a webcam, a small boxes, and some instruments. You can do it at your home. Another question that was posted by a colleague, it's laparoscopic general surgeons suggest spinal anesthesia as a possible for anesthesia or local anesthesia. It's impossible to do abdominal surgery with spinal or local anesthesia. Our patients are in general anesthesia, okay? Because this is the abdominal surgery, and the patient should stay still, and all the structures of the body should remain still to get correct surgery. So it's impossible to perform abdominal surgery without general anesthesia. Some surgeons, like the orthopedic surgeon that do limb surgery, has knees or foot surgery, could have other kinds of anesthesia instead of general anesthesia, has plex anesthesia that gives the anesthesia just of the limb, but it's different surgery. So I will summarize that for abdominal surgery, laparoscopic abdominal surgery, you need general anesthesia, okay? I'm trying to see more questions.
Well, I have one here, Nuno, is asking whether my university provides medicine education to foreign students in English language. Unfortunately, not in pre-graduation, so these post-graduation courses are in English, but pre-graduation courses, they are in Portuguese for the time being. Now, in the future, this is going to change, but not right now. So when we move to the new facilities, we will have a different way of teaching, and English is going to be contemplated.
We have another question here, Professor. I'm trying to read it. Okay, they are asking if the embalming technique differs according to the age of the cadavers.
Yeah, if the embalming technique, no, it does not differ, no. The only thing that differs is the mass of the body. So as we can easily understand, if if the body is quite heavy, then we need to do an embalming which perfuses more liquid, so more embalming liquid. And this is, as you could see, is easily controlled by the way the skin is being perfused by the embalming liquid. We know when we need to stop, and this is very important, because if we do a few quantity of liquid, then we are going to have preservation problems, and if we over perfuse, then the skin is going to become very tough, and this is not at all desirable. So you need the experience to do this. You know, I've performed myself many hundreds of embalments, and you start feeling what is the best way to control your embalming process.
Professor, we have two more questions. The first one I think I can manage to answer. What about fees structure? So they are asking us about the fees that the students pay and the structure, the economic structure of this course. So I'm going to try to answer. As I said, you should have the support of the industry, because without them, it will be impossible to have this kind of course. Why? Because this equipment comes from the companies that help us to build this course. So we have 6 operating rooms working in simultaneous. It's like a big hospital with 6 patients doing the surgery. So we must have the support from the companies, and also the economic support from the industry. Why? Because if we do not have this economic support, the fees that the students will pay will be huge. I can tell you that normally the students pay 1,000 euros during this course, okay, to be able to pay all the expenses that we are getting throughout the course. I have a final question here, that what were the qualifications required for this course? So, as I said in my presentation, to come to this course, you must be a medic, of course, a surgeon, a neurologist, or a resident in neurology with previous laparoscopic surgery. Without previous laparoscopic surgery, you are not be able to get to this course. Why? Before, in the formula, in the candidatory formula that students are obliged to fill, they must put their skills in laparoscopic surgery. And if they do not have basic skills, they are not be able to come. Why? Because this is an advanced course. If people don't know about basic skills, you should not come to this course, because this is an advanced course. This is for people who have some experience in laparoscopic surgery, okay?
Okay, so, Satyam was trying to ask a question about laparoscopic surgery. This will be the last question. And anyway, I would like to thank all the nice comments that were also provided in the chat. And naturally, I see Professor Gulmira there once again to thank her for this invitation and the opportunity to share with you our experience. So Satyam, if you wish, you can ask your question, but either writing, or if you want, maybe Arai can put you, can liberate your microphone. So it's Satyam Singh. Do you want to ask your question live? speaking? No? Anyway, you can easily contact any of us. So Dr. Nuno about the laparoscopic surgery of the in urology, and for me, everything that is related to the anatomy department, the donation program, and the embalming techniques. I will be very happy to provide, we will be very happy to provide all the answers that you need. So you have the email from Nuno there.
Yes.
And my email as well here. So you can.
Here we have the Twitter page, the Urology UCAT, and also this is my email and the Professor Diogo Paes email. Okay, please feel free to give send us the email or wherever you wanted to help you doing your best in teaching surgeons to become better surgeons.
Okay, so if no other questions, thank you so much for your presence and for being here with us. It was a real joy to be here, and I hope all the good in the world for you and your future. Thank you.
Thank you.
Okay, thank you. Thank you so much, dear Professor and Diogo Paes and Dr. Nuno Domingues. It was very practical, valuable presentation from you. Thank you for your inspiring learning experience and just for sharing with us your experience in that field. I hope everyone who was participants today can get the possibility to receive some tools and ideas can be implemented in their futures. As you see, we have a lot of students here who is at their bachelor degrees. Maybe they have learned some ideas which can be practical for them. So we can thank you for students also who participate in that workshop. It was very, very good webinar.
Thank you, Arai. Thank you, Arai, for your assistance as well. Thank you.
Thank
You're
you.
welcome.
Bye-bye.
Bye-bye.
So this has been recorded, right? So
Yes.
people can have access to it afterward as well.
Yes, of course.
Thank you.
Thank
Bye-bye.
you. See
Bye-bye.
you.
Thank
Best
you.
regards
Thank you
from
so much.
Portugal. Okay. Have a nice Congress. Bye, Professor.
Bye, Nuno.
Good work and a good weekend.
Yeah, a lot of work still to come.
I know.
Yeah, I have a meeting at noon in Portugal.
Okay.
Bye.
Now I'm going
Bye-bye.
to enjoy my weekend. Bye to you all.